you had that heart sync letter or telephone call from the GP telling you you've got pre-diabetes? Maybe your heart sank because you know what this means, or maybe you'd never even heard of it before, or you weren't expecting it at all. Suddenly, you're left with more questions than answers. What does this actually mean for you? And what are you supposed to do next? If this sounds familiar, you're not alone. And today, I want to help you make sense of what this really means. And let's be honest, most people don't know what pre-diabetes means until they're given the diagnosis themselves, often in the form of a letter from the GP. And maybe you've opened the post one morning and saw those words for the first time. Your recent blood test shows you've got pre-diabetes. There's no warning, often no conversation, just a few lines on a page. It's no wonder so many people feel confused, worried, or even a bit dismissed. Now, the NHS is stretched. I know this, I work in it as a GP, and sometimes the best way to communicate is by a letter or a telephone call, but it does arrive out of the blue. It can feel impersonal, almost as if you've been handed a label without any real explanation. There are education programmes popping up, but they seem to be a bit sporadic around the country. There are so many questions to be asked. You might find yourself thinking, what does this actually mean? Am I ill? Is this diabetes? Which diabetes am I heading for? And what am I supposed to do now? So here's the truth. Pre-diabetes means your blood glucose is higher than normal, but not yet high enough for a diagnosis of type 2 diabetes. It is a warning sign, not a sentence. It's your body's way of saying, something's changing, now is your chance to do something about it. From a medical perspective, we measure your blood glucose with a test called the HbA1c. If your result is between 42 and 47 millimole per mole, this is in the pre-diabetes range. It's not a disease in itself, and it doesn't mean you're definitely going to develop diabetes, but it does mean your body at the moment is struggling to keep your blood glucose in check. And now is the best time to take action. So let's get clear, why does this even matter? Why do doctors, nurses and health campaigns care so much about pre-diabetes? It's not just about the number or ticking a box on the medical record. What we're doing is protecting you from something much bigger and honestly much harder to reverse, which is type 2 diabetes. Type 2 diabetes is not something that just appears out of nowhere. It is the end result of a slow, silent process that can build up over years, sometimes without a single symptom. By the time you're diagnosed, a lot has already changed inside your body. In fact, research shows that around half of the insulin-producing cells in your pancreas are already not working as they should be by the time you get that diagnosis. That means your body is already struggling, often for years. It's struggling to keep that blood glucose in check, and it does take its toll. Pre-diabetes is a part of this journey. Everybody with an eventual diagnosis of type 2 would have passed through this phase at some point. But why is this such a big deal? Well, it's because high glucose doesn't just stay in your bloodstream. It travels everywhere, and over time it can quietly damage your eyes, your kidneys, your nerves, your heart, and unfortunately even your brain. It increases your risk of heart attacks, strokes, blindness, kidney failure, nerve pain, infections, and even dementia. It can of course affect your energy, your independence, your mood, and your ability to do the things that you love. That is why pre-diabetes matters so much. It's not a technicality or a scare tactic. It's a genuine early warning, a chance to step in and make changes before these complications even have a chance to take hold. When you understand what you're trying to prevent, you can see why this early detection is actually a gift. It's your chance to protect your future, your family, and your quality of life. So one of the first questions I get asked, often with a real sense of worry, is, does this definitely mean I'm going to develop diabetes? And I want to be absolutely clear, because the answer is no. Having pre-diabetes does not mean you're doomed to develop. It's not a guarantee, and it's definitely not a life sentence. Here's what the science tells us though. If you did nothing at all, so if you carried on with the same habits and didn't make any changes at all, about 70%, 7 out of 10 people with pre-diabetes will eventually develop type 2 diabetes. Now I know that can sound scary, but actually it does mean that 3 out of 10 people never do. But more importantly, the earlier you catch pre-diabetes and start making changes, the more you can tip the odds in your favour. Those stats if you did nothing. I see the majority of people that I help reverse their pre-diabetes, they do get back into the normal range when they focus on the things that matter, which is their lifestyle. So think of pre-diabetes as a fork in the road. One path is going towards diabetes, but the other can lead you back towards health. You're not stuck on a conveyor belt heading in one direction. You do have choices and you have time to change course. The fact that you know about it means you're already ahead of the game. Many people don't even get this warning. So no, not everyone with pre-diabetes will develop diabetes. And with the right information and support, you can take steps to make sure you're one of the ones who don't. So let's dig into what actually increases your chance of pre-diabetes developing. Understanding your own risk isn't about blame, it's about power. The more you know, the more you can do to protect yourself. Let's start with weight. Carrying extra weight is, without a doubt, the strongest risk factor for developing type 2 diabetes. And it's not just about being overweight by the charts or the scales or what you see in the mirror. The real issue is where you're carrying that weight. Many people focus on their BMI, but it doesn't tell the whole story. The most dangerous fat is the visceral fat because it's wrapping itself around the internal organs like your liver and pancreas. It's metabolically active fat, meaning it releases chemicals that are causing inflammation throughout your body. It is also making your cells less responsive to insulin. And when your cells become less responsive, your pancreas has to work harder and harder to keep your blood glucose in check. And here's something most people don't realise. You can have a normal BMI and still have too much visceral fat, especially if you tend to store weight around your middle. This is something called tophi, thin on the outside and fat on the inside. Even if your arms and legs are slim, a larger waist circumference can signal hidden risk. So the science is clear. For women, a waist measurement of over 80 centimetres or 31 inches, and for men, over 94 centimetres or 37 inches does increase your risk. But even below these numbers, if you have a family history or belong to a higher risk ethnic group, it's worth paying attention. Genetics and family history. These matter a lot. If your mum, dad, brother or sister has type 2 diabetes, your risk is significantly higher. If one parent is affected, your risk jumps up by about 40%. If both parents had diabetes, your risk can be as high as 70%. But here's the hopeful truth. Genes are not your destiny. Our understandings of genetics have changed dramatically over the recent years. What we now know is that your environment and lifestyle can turn on or turn off genes, and that is something that we call epigenetics. So think of it this way. Your genes might load the gun, so you might be at risk, but it's your lifestyle that pulls the trigger in the end. So even if diabetes runs in your family, you're not powerless. In my clinic, I've seen countless people with a strong family history who've stayed healthy by making small, consistent changes to their diets, activity and daily habits. Now, ethnic background plays a significant role in your risk profile as well. People from South Asian, Black African, African Caribbean and Chinese backgrounds have a higher risk of developing type 2 diabetes, often at a younger age and at a lower weight than white Europeans. So for example, South Asians are up to 6 times more likely to develop diabetes than white Europeans. This means you might need to be more vigilant, even if you don't fit into the typical picture of somebody at risk. For these groups though, the risk starts to climb with a waist measurement over 90 centimetres, so 35 inches for men, and 80 centimetres, 31 inches for women, lower than the general population. And this is partly genetic, but also how fat is stored in the body and how certain populations respond to modern diets and lifestyle. The key takeaway is this. If you're from a higher risk group, don't wait for your weight to creep up or for the symptoms to appear. You need to act early. Now, age is another factor we can't control, but we do understand. So the risk of type 2 diabetes does increase as we get older, especially after the age of 40. This is partly because our bodies naturally become less sensitive to insulin as we age, so our pancreas becomes less efficient. But it's not just a disease of old age. I do see plenty of people in their 30s and now even 20s developing pre-diabetes and type 2 diabetes, especially if they've got other risk factors. Sometimes people think I'm too young to worry about this, but the reality is the earlier you start paying attention, the more you can do to protect yourself for decades to come. We also know that if you've got high blood pressure and cholesterol, they often go hand in hand with pre-diabetes, and they're not just numbers to be ignored. High blood pressure and an abnormal cholesterol, especially high triglycerides or low HDL, which is a good cholesterol, are all part of what's known as the metabolic syndrome. And this is a cluster of conditions that go together: high blood sugar, high blood pressure, abnormal cholesterol, and an increased waist size. If you have one, you're more likely to have the others, and together they dramatically increase the risk of heart disease, stroke, and diabetes. But the good news is the same lifestyle changes that help with your blood glucose will also improve your blood pressure and cholesterol at the same time. Now, sedentary lifestyle, we do live in a world that makes it easy to sit still for hours, myself included, desk, car, sofa, wherever. Our bodies are designed to move all the time though. If we don't use our muscles regularly, they become less sensitive to insulin, which again puts pressure on your pancreas to work even harder. Even gentle movement makes a difference. You do not have to run marathons. Just walk, gardening, housework, dancing, even just standing up and stretching every hour can help. The key, of course, is consistency, finding ways to weave it into your day-to-day life. We also know that stress and sleep are risk factors that are overlooked, but there's just as important as diet and exercise. When you don't have enough good quality sleep, your body becomes less sensitive to insulin. You're craving sugary, high carb foods. And chronic stress is another thing that has the same effect. It releases hormones like cortisol and adrenaline, which unfortunately raise your blood glucose. So if stress is a constant in your life, your blood glucose can stay higher than it should, putting more pressure on you. So managing stress, prioritizing sleep are such powerful, underrated tools for lowering your risk. The reality is, it's really just one thing. More often, it's a combination of many. The importance is that you know where your risks lie and to remember that knowledge is power. The more you understand, the more you can do to help yourself keep healthy and confident, no matter where you're starting from. But I do want you to realise that there's so much you can do. It doesn't have to be overwhelming, all or nothing, or perfect. Every positive change, no matter how small, does make a difference. Over the years, I've helped hundreds of people move out of the pre-diabetes range and back towards health. I know it's possible. I've seen it. It's happened time and time again for people in my clinic. The key is to understand what works and to start where you are. So start with food, study carbohydrates, cut back on those sugary and starchy foods. Start there, look at your sleep, have a look at where stress can be improved and try to get more movement into your days. Don't wait for the NHS to come and help. Do the research now. And this is exactly why I set up the Lifestyle Clinic and why I'm here talking to you today. My role isn't just to explain the science or hand out test results. I want to encourage you, inspire you, and give you realistic steps that fit into real life. I know that change can feel daunting, but you don't have to do it alone. So if you're ready to take that next step and want more support, I've created a free health breakthrough video series that goes even deeper into the steps and can turn things around for you. It's packed with practical tips, real life guidance and encouragement to help you get started wherever you are on your journey. So you can download it right now using the link below. It's my way of giving you a head start so you don't have to figure this out alone. Remember, every big change begins with a single step, and this really could be yours. Thank you.